Hello, welcome to Success in the NDIS. This is the first webinar in our NDIS Success series. So thank you for signing up to CBB's NDIS Success Programme. My name is Jane Arnott, and on behalf of our business consulting team, I'd like to welcome you to the first NDIS Success webinar. Community Business Bureau acknowledges traditional owners of country throughout Australia. We recognise their continuing connection to land, waters and community, and we pay our respects to them and to their cultures and to their leaders past, present and emerging. It's been 6 years since the National Disability Insurance Scheme was introduced in Australia. There are now almost 365,000 Australians benefiting from the NDIS, and this includes 154,000 people that are receiving disability supports for the first time. The NDIS will provide $22 billion in funding per year to an estimated 460,000 people with disabilities across Australia, and that will contribute to the creation of around 90,000 jobs in the disability sector across Australia. So you might be new to the NDIS and thinking of starting an NDIS service, or potentially you're already an NDIS provider and you'd like to grow and expand your service. This NDIS Success Programme aims to support sole traders and organisations to plan for successful NDIS provision. We'll offer you tools and strategies for starting an NDIS service or for growing your current service offering. So today's webinar is the first in a series of 6 management webinars that will provide a roadmap for NDIS success. So in today's session, we'll give you insights into the fundamentals of the NDIS and help you understand what it means to provide services under the NDIS. In our second webinar, we'll speak about the importance of understanding the market you want to operate in. So do you know who your potential customers are and what they need or want from their NDIS provider, and who else is already providing NDIS services in your area? In webinar 3, we'll help you to understand how to develop an NDIS service model. But the NDIS is highly regulated, so providers need to understand the NDIS code of practice, and the quality and safeguarding rules and regulations. So in webinar 4, we'll give you insight into compliance requirements for registered providers and for those of you that are planning to provide NDIS services without registration. In webinar 5, we'll give you tips on how to set a strategic plan and how marketing can help you to achieve your goals. And in the last webinar of our series, we'll explain the importance of understanding your potential revenue and associated costs. Clearly, your financial viability is crucial for your long-term sustainability within the NDIS. If you haven't registered for the programme, please do visit cbb.com.ndis and complete the registration form. And we'll set up calendar invites for your reminders for your future webinars. So each of our webinars will be followed by a Q&A session to give you an opportunity to ask questions that come up while watching the webinar or when working through the tools and templates we'll be providing. We encourage you to submit questions at any time before the Q&A session, via the Facebook group or via email. So if you haven't joined our Facebook group yet, please do. It offers you an opportunity to network, share ideas or problems, and offer answers outside of the Q&A sessions. So just search for CBB NDIS Success in Facebook. Operating in the NDIS is complex, requires a lot of preparation and learning about how it all works. So we've compiled a template business plan, which will help you to work through the different stages that you need to consider when planning your NDIS service. We'll also provide activity worksheets for each webinar and guide you through exercises and questions you need to ask. Additional information links will be available via our website too. So to maximise your understanding, we strongly recommend that you watch all the webinars and work through the activity worksheets. And you can either pause the webinar to work through the worksheets or work on that after each session. So today's session looks at successful NDIS service provision. So we'll have a look back and give a brief history of the NDIS and why it was introduced and what it's trying to achieve. We'll explain who gets access to services and what it takes for somebody living with a permanent and significant disability to be accepted into the NDIS and access services. We'll then discuss what's funded in an individual's NDIS plan, and we'll look at the NDIS business model and where the opportunities might be for service providers. We'll also look at some of the current challenges and give you an opportunity to think about some of the issues about whether you should take up registration or not. So we'll explain some of the differences between registered and unregistered providers. And at the end of the session, we'll give a brief outlook into some of the upcoming changes in the NDIS. So our little crystal ball, if you like, of what the future might hold. Today's webinar is designed for people that are new to the NDIS. So if you're already familiar with the NDIS or already running a service, much of the content today won't be new for you. So you're welcome to watch the webinar if you'd like a refresher or an overview, but you might prefer to join our Q&A session on the 11th of August or jump straight to webinar 2, which will be available on the 18th of August. So the NDIS provides supports to people with disability in Australia. It's the biggest social policy reform since the introduction of Medicare and was introduced after years of discussion about the need for major reforms of disability supports in Australia. In 2008, Australia ratified the United Nations Convention on the Rights of Persons with Disabilities. It's the first human rights treaty of the 21st century and moves away from seeing people with disability as objects of charity, for medical treatment and social protection, and instead considers people with disability as equal in terms of their human rights. So they're able to make decisions for their own lives and can be active members of society. As a response, Australia introduced the National Disability Strategy in 2010, and the intention was to develop a strategy guide for the development of policies across all states and territories. It aims to create an inclusive society that removes barriers and enables people with disability to fulfil their potential as equal citizens in Australia. So that concept of inclusion means that people with disability can participate in everyday activities and have the same opportunities as everyone else. In an inclusive society, we respect differences and we accept people for who they are. So a public inquiry into long-term disability care and supports in 2011, however, despite all these words about inclusion, found that Australia's disability support system was underfunded, unfair, fragmented and inefficient, and it gives people with disability little choice and no certainty of access to appropriate supports. Most Australians with disability were living below the poverty line. The Commission suggested the implementation of an insurance scheme to support the entire Australian population to minimise the impacts of disability, to provide information and referral services to anyone with a disability, and to provide long-term care and support to people with significant and ongoing disability. So the NDIS Act was introduced in 2013 to replace the previous system of disability care and support, and the legislation established the National Disability Insurance Agency, or the NDIA. The NDIA can offer coordination, strategic and referral services to anyone with a disability. That part of their responsibility is now funded through Information Linkage and Capacity Building Programme, or ILC Programme. The NDIA also administers the National Disability Insurance Scheme, the NDIS, which offers individual support for people with permanent and significant disability. So it's estimated that 4.3 million Australians live with a disability, and that's 1 in 5 of us. People with disability get support from family, friends, community, and mainstream systems such as health, child protection, and education. The NDIS does not replace any mainstream services. Only 460,000 of those 4.3 million Australians with a disability are expected to get an NDIS plan. Partners in the community are agencies engaged by the NDIA, and they are local area coordinators, or LACs, and early childhood early intervention partners that help people with disability to access services and conduct most of the planning meetings for individual NDIS plans. So that's your ecosystem, if you like, of the supports that surround people with disabilities, including the NDIS. Okay. So the NDIS has moved away from this old welfare system, and community inclusion is now an integral element of supporting people with a disability. So people with a permanent and significant disability can access reasonable and necessary support over their lifetime. Disability service providers or community organisations no longer receive block funding for disability supports, and individuals get funding instead in their NDIS plan, so they have choice and control over spending those funds. So they can decide what services they want, where that should be delivered, how much, when they're going to take it, and who is going to provide those services to them. Charging for services on an individual basis does present a major challenge for service providers who need to ensure that the income through individual services covers the cost of service delivery. So a much more commercial model than the previous models of block funding and contracts. So who can get access to the NDIS? So any Australian citizen or permanent resident can access the NDIS if you can prove that you have a permanent and significant disability. It's an insurance scheme for all Australians under the age of 65. So children under the age of 7 can get supports from the Early Childhood Early Intervention programme. To get access into the insurance scheme, the NDIS will need to be satisfied that a person's impairment is serious and permanent. So you need to demonstrate that the disability substantially reduces your functional capacity to undertake communication, social interaction, learning, mobility, self-care or self-management. And the NDIS requires a functional assessment of what a person can and cannot do. So this is also used to identify the individual support requirements and plan funding. So diagnosis is not determining the funding amount, it's actually the functional capacity. So more information about the required evidence is available in the NDIS operational guidelines, and the evidence needs to be documented by a treating health professional who's relevant to the primary disability and needs to confirm the primary disability. Most importantly, the evidence needs to be recent. After gathering the evidence, a person with disability can apply for NDIS access. Once the access is approved, the person's called a participant by the NDIA. So participants are the recipients of service under the NDIS. If they're approved, they attend an annual planning meeting with the local area coordinator or LAC. And the NDIA conducts the planning meetings themselves for people with more complex needs or in remote areas. And at the planning meeting, the participant is asked about their goals, their existing supports, and the support they need to achieve their goals in the year ahead. The NDIA assesses whether the supports requested are reasonable and necessary, and whether they should be funded by the NDIS or if they're responsibility of another service. It's extremely important for people to be well prepared for the planning meeting because of the level of information required. The access path is a difficult process for many people, and people without supports are falling through the cracks or aren't getting sufficient funding. It's evident by looking at the number of people with an NDIS plan from Aboriginal and Torres Strait Islander communities or people from culturally and linguistically diverse backgrounds. Only 6.2% of NDIS participants are Aboriginal and Torres Strait Islanders, and 9.1% of participants are from culturally and linguistically diverse communities. There are cultural differences in how we view and respond to disabilities, and these can result in significant barriers to accessing supports and services. Remoteness is also a problem in terms of accessing the scheme and supports. So only 1.4% of NDIS participants currently live in remote or very remote communities. So what should be funded in an NDIS plan? What can you expect? So according to Section 34 of the NDIS Act, the supports need to be related to a person's disability and not include day-to-day living costs. So food, for example, is not funded under the NDIS because it's a day-to-day living cost. However, the cost of food preparation and delivery might be funded if the person's unable to cook or shop for themselves. The funding needs to represent value for money and assist somebody to pursue their goals. So if your goal is to spend more time with your family on the beach, you may get funding for a special beach wheelchair if that's what you need to enable you to do that. But if you're living 800 kilometres away from the beach, a special beach wheelchair might not be considered reasonable and necessary. So the NDIS plan should assist and increase participation in social and economic activities, and the supports need to be effective and beneficial and take informal support into consideration. This means that often parents don't receive funding to care for their children with complex needs or sufficient funding to do so, as the care for children is considered the responsibility of parents. Also, the NDIS needs to be the most appropriate funding body and not the education or healthcare sector. And the interface with health can be challenging at times. However, the NDIS is also now funding health-related disability support. So what determines funding in an NDIS plan? So the age and stage of a participant's life, the primary disability, the functional impairment, the living situation, and that person's goals will all change and determine the way that somebody's plan is funded. So the NDIS may fund goals such as development of independent living skills, or to participate in art, to drive a car, to lose weight, to learn new skills, to get work, or to move away from home. So together this creates quite a complex formula that results in funding of supports. So people with the same disability and support needs can receive very different funding packages depending on their informal support networks, their living circumstances, and their goals. And planners can interpret information differently, and funding packages can vary from one year to the next. This has been challenging for people with disability and for providers, because you could see two people that appear to be in the same situation that have different plans. Better training for planners might lead to more consistency, and giving people the opportunity to review a draft plan before it's finalised could also help to avoid insufficient plan funding. The NDIA has indicated that that might be possible in future, but it's not been put into practice yet. So what does it look like doing business in the NDIS? So the introduction of the NDIS has shifted the way that supports are delivered. So they're now individualised, customer focused, and the person with a disability is at the centre of service delivery. So you'll hear this expression, person-centred. Anyone delivering NDIS supports needs to genuinely care about the person they support and truly listen to that person and find solutions that work for them and build on their strengths, abilities, and skills. People with disabilities are subjects with rights and capable of making their own decisions. So their needs are definitely the driver of the supports rather than the convenience of the service provider. So the person with the business with the NDIS plan is the purchaser of services, and the plan provides funding for supports for the length of that plan period. Plans are usually valid for a year, but can be for up to 2 years. And the person can choose their provider, and depending on the total funding amount, can purchase as many services as they need. However, the person cannot spend more than the amount provided for in the plan. Terms and conditions of the service should be agreed in advance with the purchaser, the participant, and the person pays for the service after the service is delivered. So the NDIS price guide sets the terms and conditions for NDIS service provision, such as cancellation rules, which activities, whether you can charge for cancellations or not, and which activities the provider can or can't charge for. For example, for some services, providers can charge their travel time or for non-face-to-face activities, as well as the service delivery itself. The NDIS support catalogue is the NDIS price list. It sets the price limits for support categories such as personal care, community access, domestic assistance, and professional services, and helps to clarify what can and can't be claimed. Most prices are listed on an hourly service provision, and as a provider, you'll need to understand and apply these rules. You're also obliged to comply with Australian consumer law and the Competition and Consumer Act. In 2019, the price guide was updated about 6 times, and since January of this year, NDIS providers have worked under 3 different versions of the price guide. For example, there was a temporary 10% increase of prices for some services from the end of March to July to support providers continue to provide services during the COVID-19 crisis. A completely new format for the NDIS price guide and NDIS support catalogue were introduced on the 1st of July, and some of the interim COVID provisions still continue, but the 10% price loading was removed. You can find a summary of all the recent price guide changes on the CBB website and our monthly free forward blog. The latest annual price guide has suggested that the process for the price review for next year, for 2021, should start now so that providers will learn sooner about upcoming changes in 2021. Since the NDIS started, prices have seen an adjustment of 70% increase, including increases last year for between 20 to 27% for standard supports. Prices for services provided in rural and remote areas have also increased, so 40% for remote service for rural and 50% for remote service provision. Some services are inevitably more profitable than others, and remote service providers do still struggle to generate enough income. So the State of the Disability Sector report is published by National Disability Services, so they're the peak body for not-for-profit disability service providers. And they provide a good insight into how the disability sector is doing. So last year, only 11% of those surveyed, the providers surveyed, said that they were considering leaving the disability sector. So that indicates a fairly good level of confidence in the sector. 25% of respondents stated that they would stay as providers but not grow. And when asked if the provider was intending to change their service volume in the next 12 months, between 50 to 70% of providers said they were planning to grow services depending on the service type. Most providers said that they have more requests for services than they can deliver, which shows that there's not enough service available currently. The biggest challenge that providers identified were the constant NDIS changes. So operating in the NDIS requires ongoing learning and changes to systems. About 53% of providers said they were worried about their ability to adjust to ongoing changes. In some ways, it can be easier for new providers who aren't dependent on legacy systems and processes to adapt to the NDIS, but all providers need to be prepared to be flexible and adaptable to a changing operating environment. Obviously, this survey was conducted before the COVID-19 restrictions were introduced, and we'd expect to see some very different results for 2020. COVID-19 has presented some significant challenges to providers, and providers of group activities and community engagement have really had to adapt their business models, while providers of core services such as personal care have had to operate under increased operational challenges around around infection control and access to PPE. So over the life of the scheme, 14,534 registered providers have provided supports to participants. However, only 63% of these are currently active, with a further 4% who provided supports for the first time in the quarter up to March 2020. This leaves 33% of providers who were inactive in the last quarter. Therapeutic supports and household tasks are the registration groups with the largest number of active registered providers. 43% of active providers are individuals and sole traders, and there are also countless unregistered providers delivering NDIS supports. Again, these tend to be smaller organisations and sole traders. If a provider is not registered with the NDIS Commission, the provider cannot provide services to all people with an NDIS plan, and unregistered providers can provide services to people with plan-managed and self-managed NDIS plans. So we'll explain the difference shortly. So where do the opportunities for growth come from? We heard from that State of the Disability Sector report that most providers are saying they can't meet all of the demands for service. And we know from the latest NDIS reports how much a plan budget is actually spent. So looking at national figures, on average, only 68% of plan funding is spent. The plan utilisation is higher for core supports, around average for capital at 65%, but lower for capacity building at 56%. Plan utilisation is also higher for people who live in group homes and receive supported independent living support, SIL funding. For this group, utilisation is at 83%. But people who don't have SIL funding on average only use 61% of their plan value. So with the exception of SIL funding, depending on your supports, anywhere between 30 to 40% of the plan funding is not spent. There are variations across regions and states as well. This graph shows plan utilisation by remoteness. So the national average of plan utilisation in remote areas in Australia is at 58%, so that's 10% below the national average across all areas. And in very remote areas, only 39% of plan funds are used. So why is this money not being spent? So a persistent problem for the NDIS is that services are not available. So people in rural and remote areas often have little option of where to access their services. The NDIS is difficult to navigate, and often people don't understand how and where to spend their plan funding. Support coordination is a funded support that helps people with an NDIS plan to find and connect with services, but most people don't have it in their plan, and it represents only about 3% of total committed plan funding across the NDIS. On average, plan utilisation increases the longer people are in the scheme. So the more familiar they are with the NDIS, the more of their plan they use. So it represents about 56% for people in their first plan to 78% by the time people are in their fifth plan. So also, interestingly, plan budgets are increasing the longer someone is receiving NDIS supports. So the NDIS is also difficult to navigate for providers, and we've noticed in our work with providers that often they're not charging fully for the services that they're entitled to. So again, that leads to funding gaps for providers and lower plan utilisation. But we also think that 100% plan utilisation may not be the norm. Often life changes, things get in the way, life goals and circumstances and needs can all change over the course of somebody's plan. So we've mentioned registered and unregistered providers, so let's have a look at those in a bit more detail. So this really depends on understanding how provider gets paid. So how a person manages the NDIS budget and their NDIS plans. And there's 3 different ways to manage the budget and to pay a provider for their NDIS service. So there's NDIA or agency managed plans, plan managed, or self-managed plans. So how's the provider paid? Well, if the money is NDIA or agency managed, the provider claims the payment directly from the NDIA after the service is being provided. The provider can only charge up to the maximum price set in the NDIS price guide and support catalogue. The NDIA will pay the provider from the person's NDIS plan, and payment generally takes about 3 business days, but there can be delays. This is different if the money is plan managed. So here there's a plan manager, so a third party, and the provider invoices the plan manager for the services, and the plan manager pays the provider after claiming the money back from the NDIA. Again, the price for the service must be in line with the NDIS price guide and support catalogue. The plan manager must be registered with the NDIS Commission as a plan manager, and the NDIS will provide separate funding in the plan to pay for the service of the plan manager. If the money in the NDIS plan is self-managed, so the final category, the person will pay the provider directly and will claim the money back from the NDIA. In this case, the price for the service isn't bound by the NDIS price guide, and the provider can set their own price, and the person receiving the support can negotiate the price of services. So this determines who can provide services. So people should be asked at their planning meeting how they want their money to be managed, and they're free to choose plan management, agency management, or self-management. So anyone can request plan management, and with some exceptions it will be approved. The advantage of plan management is the person can spend their funds with both registered and unregistered providers. If the money is NDIA managed, the person can only use registered providers. Self-management tends only to be approved for people who can confidently navigate the system and are not at personal financial risk. And many people choose a combination of how the money is managed in their plan. So, for example, transport funding is often self-managed to allow people to manage that more flexibly. So as of March this year, 38% of plans were plan managed, which is more than agency managed plans at 32%. 19% are currently fully self-managed and 12% partly self-managed. So if we look at some trends, over the last 3 years, the percentage of plans that are partly or fully self-managed has increased from 20% in 2017 to 31% now in 2020. It tends to be younger people who have self-managed plans, indicating that many parents are managing the NDIS funding on behalf of their children. Adults are more likely to have a plan manager. And you can see the trends very visibly here in this graph. This illustrates the growth in plan management of NDIS plans between March 2017 and March 2020. Following the light green bar, you'll clearly notice the drop in agency managed plans, and the dark green bar shows the growth in plan management from 9% of plans in 2017 to 38% in March this year. The number of plans that are fully self-managed has also more than tripled since 2017. So if more plans are getting plan managed and self-managed, and if people with NDIS plans can purchase services from registered and unregistered providers, what does that mean in terms of registering? So if you're a small provider with an established customer base and without ambition for growth, so you're happy operating as you are, there may be no need to become a registered NDIS provider, provided your customers' plans are plan or self-managed. But it's worth considering that whilst only 38% of the total number of plans, sorry, it's 32% now, of the total number of plans are agency managed, 61% of plan value is managed by the NDIA. So that must be spent with registered providers. And that's because people with agency managed funds tend to be those that are most vulnerable, and they're likely people with little formal support or more complex support needs. So there is a risk that we're creating a system that supports more privileged people who are able to plan manage or self-manage, while ignoring the support needs of those that might be more vulnerable and having agency managed plans. So if you're an established provider of disability services or related services, you might want to consider how it will impact on your brand and reputation if you're providing NDIS services only to those with self and plan managed plans. So really you're making a decision that you're going to exclude others from your services. If you're a sole trader and you're concerned about the cost of registration, you could consider working as a subcontractor to a registered provider, or you could find like-minded people in your area and take up registration as a group to share the costs. So some of the other things to consider whether you choose to register or not. This table compares the requirements of registered and unregistered providers. So a registered provider, as we said, can provide services to all people with an NDIS plan, provided they're registered to provide that particular service. For some services, the provider must be registered. So plan management, specialist disability accommodation, behaviour support, and implementing behaviour support plans. If you're providing any of those services, you have to be registered. Both registered and unregistered providers are obliged to provide services that are safe and protect people from harm, so that applies across the board. And all providers need to comply with the NDIS Code of Conduct, carry out worker screening, and have complaints management systems in place. To register, a provider needs to undergo a registration process and regular audits, and we'll discuss those in a lot more detail in webinar 4. And that requires the provider to establish quality systems and procedures to implement those systems throughout the organisation. The other factor to consider in registration is it does communicate with your customers that you're putting in an effort to keep them safe and that you have those procedures in place. Many providers who have undergone the registration and audit process have fed back to us that it requires commitment and hard work, but most acknowledge that it also improved many aspects of their operations and improved outcomes for their customers. So what's the future for providers and people with NDIS plans? So as I said, here's our crystal ball. So we're optimistic that the key issues of the NDIS will be addressed over time and the scheme will operate more effectively for people with disabilities and service providers in the longer term. The NDIS Act is currently under review, and in January 2020, the Tune report made 29 recommendations aimed at improving the NDIS for people with disabilities, their families, carers, and service providers. The recommendations included more clarity around what's reasonable and necessary and what remains the responsibility of other systems. The report also recommends reducing administrative red tape and more support for people with disability to navigate the scheme. The NDIS announced that in 2020, people will be able to view a draft version of their NDIS plan, and that would allow people to review and amend their personal details, their goals, their living arrangements, and their supports prior to plan finalisation. Unfortunately, this hasn't been introduced yet, and often we still see people with disabilities receiving plans with insufficient funding, and then it's a bureaucratic battle with the NDIS to argue for adequate supports. NDIS Minister Stuart Robert has said that in future, planning may be joint between the local area coordinator and the NDIA planner. And we don't know yet how that will work in practice, but it could lead to better plans that more accurately reflect people's support needs. In July, the NDIA announced improvements for people living in remote areas, and the Community Connectors Programme, or NCCP, will support people with disability from hard-to-reach communities and disadvantaged population groups to access and navigate the NDIS. The NCCP will be rolled out over 2 years and will build on the existing agency community connected programs. The NCCP will focus on supporting targeted communities such as Aboriginal and Torres Strait Islanders and people from linguistically diverse communities, plus participants with ageing parents, parents of children with disability, and people experiencing psychosocial disabilities. And the aim of that programme is to help people to navigate the NDIS and to get the services that they need. The NDIS has acknowledged that a one-size-fits-all approach doesn't work and has started pilot projects in all jurisdictions to address market gaps relating to geographic locations, particular cohorts of participants and disability types. But we understand that, no surprise, due to COVID-19, some of these trials are currently on hold. As mentioned, the NDIS has been responding to the COVID-19 crisis in offering some extra support to providers and is reviewing the situation on a regular basis. For example, registered providers could access 1 month prepayment of services to ensure cash flow within the business, and that's only been available to registered NDIS providers, so it highlights that there are some advantages to registration. The National Disability Insurance Scheme is projected to continue to grow and reach 500,000 people with disability within the next 3 to 4 years. It's forecast to cost 1.2% of GDP, and further growth provides opportunities for NDIS providers. So that's your introduction to the NDIS. Where to go from here? So in today's webinar, we gave you an overview of why the NDIS was introduced, who it's supported and what supports are funded. We discussed the service model and gave insight into potential opportunities for new and existing providers due to low plan utilisation rates. And we encourage you to reflect on what we've covered today and where you might need to do some additional reading or training to improve your understanding of the NDIS, particularly if you are new to the service. As we said, this webinar was very much aimed towards new providers. So you might want to record this activity in your worksheet to build out a bit of an action plan of the things you need to do, and spend some time visiting our website and elsewhere for additional links and information. So if you're new to the NDIS, here are some questions that you might want to ask. So, for example, can any of your existing services be provided to people with NDIS plans? So we're working with some providers at the moment, for example, that are already providing services into Aboriginal and Torres Strait Islander communities and recognise that those services could be provided within an NDIS context. Should we provide NDIS services? Is that something that's a good fit for you as an organisation? And would it align with your mission, vision, and the people that you support? So again, circumstances where organisations recognise that some of their clients, their existing clients, are likely to be NDIS participants or to be eligible to be NDIS participants. So is there an opportunity for you to provide services to them in that context as well? So if you're already an NDIS provider, you need to be asking questions about whether you grow your NDIS service and what other services might fit into your mission and vision, and whether you're actually charging according to the NDIS price guide. As we said earlier, some of the providers we've been working with haven't actually been claiming all of the funds that they could. Are the people you support getting the NDIS services they're entitled to, and do they have access to the services they need? So are you seeing gaps within your existing client group? So after watching this first webinar, please do have a look at the questions in the activity worksheet in the workbook, and to find the resources and more, please visit the NDIS Success tab on our website. Please join the Facebook group and post a question or like a question so we know when we do the Q&A which ones are most in demand and which ones we should cover off. Our first Q&A session will be on the 11th of August. And the data that we've used from today's webinar is from the NDIA's quarterly report for March 2020. So the NDIA produces a quarterly report every 3 months. It was due, the latest one to cover the period to June 2020 was due on the 31st of July, but it wasn't available at the time of recording the webinar. So we're expecting it to be published at any moment. And if this report comes out before our Q&A on the 11th of August, we'll also be discussing some of that new data as part of the Q&A session. So in our next webinar, we'll talk about the importance of understanding the NDIS market before you start a new NDIS service or look to grow your services. We'll give you tools to investigate the market need for services, which will help you to decide if you should grow services in your current area or in new regions. The webinar Understanding the Market will be available on the 18th of August. So please do watch out for that one. And thank you for watching the first webinar in our series, Success in the NDIS, and goodbye for now. Thank you.